Well, good afternoon, everyone. Thank you for joining us today. On behalf of my colleague, Matt Jones, Minister of Jobs, Economy and Trade, I am pleased to introduce Bill 25, the Early Learning and Childcare Amendment Act 2024. If passed, these amendments would strengthen Alberta's safe, high-quality, accessible, and affordable childcare system to meet the diverse needs of Alberta families. Albertans rightfully expect high-quality care. When standards are not met, they deserve to know that something is being done about it. Today, we are fortunate to have and be joined by one of those parents, Narnia Care Director, Austin Goldie, accompanied by her children, Evan and Paige. Austin will share a parent's perspective on our ELCC amendments. And thank you for being here. The proposed amendments will make it easier for Alberta's government to act quickly and in the public interest when children are at risk or operators are not meeting standards of care. Alberta's government knows that the vast majority of providers and early childhood educators are committed to helping children grow and thrive through high-quality care. In fact, we have a prime example of a top-notch care provider here today to support the bill. Bernice Taylor is the program manager at Drayton Valley's Early Child Care Development Center and has been working in childcare for over 30 years. Thank you for being here, and I probably said your name wrong there too, but I apologize. We heard from operators, parents, and medical professionals how revisions to the Act could improve safety for kids in our childcare setting. And this ELCC legislation is Alberta government's delivering on that feedback. Bill 25 will give our child care licensing team the necessary enforcement tools and capabilities to hold bad actors accountable when they do not prioritize the well-being of children. With these new amendments in place, our child care team would have the ability to respond swiftly and effectively to health, safety, and quality issues in child care programs, noting that these decisions are made independent from the minister. The proposed legislative changes allow Alberta's government to temporarily close all or part of a child care program, cancel a license, or impose administrative penalties when child safety is at risk. It also ensures providers revise their program plan to bring them back into compliance when instructed by the statutory director. These changes would leave the majority of childcare operators and professionals free to continue delivering the exceptional service that they always have, while ensuring that the small number of bad actors are held accountable should children be at risk. This would bring Alberta in line with many other Canadian jurisdictions where similar enforcement options are currently in place. To ensure that these changes do not risk a provider's right to fair treatment, they will still have access to an appeals process, just as they do now. To help maintain public trust in the child care system, these amendments will also increase transparency, ensuring educators and parents are better informed about potential safety and quality issues in their child's place of care. If Bill 25 passes, parents will have access to information about the status and level of certification for early childhood educators, so they can trust those individuals looking after their children are trained and certified professionals. Parents would also have access to information about whether an unlicensed childcare provider has been issued any stop orders in the past. This means parents can easily find out if an unlicensed program has been non-compliant with ELCC legislation and identify the type of non-compliance issued. Family day home agencies, which are the license holders that oversee family day homes, will also be required to advise educators if there are any compliance issues or penalties administered, because educators running family day home programs should have the right to know whether the agency that oversees them is currently subject to any enforcement action by Alberta's government. I'd also like to highlight the ways that these amendments would improve health and safety in a childcare setting. After the devastating E. coli breakout last year, Alberta's government set up the Food Safety and Licensed Facility-Based Child Care Review Panel with the intention to find ways to prevent such a thing from ever happening again. I'm joined today by Dr. Lynn McMullen, professor at the University of Alberta and a member of that review panel. Her work was pivotal to providing the government with valuable recommendations to improve safety in childcare setting, and I look forward to hearing from her later. In line with one of the panel's recommendation, Bill 25 will clarify that all facility-based license holders must comply with applicable zoning and health and safety legislation. This was implied but not explicitly stated in the ELCC Act, so we wanted to formally clarify this. Another way our government is keeping children safe in child care programs is to make sure that there is enough staff on hand to supervise and engage with them. Bill 25 and the subsequent regulatory updates will clarify that 16 and 17-year-olds can work in the sector as long as they are supervised by an adult. Alberta's government remains committed to working alongside providers and parents to build an affordable, accessible, and high-quality child care system. They deserve a system that works for families long into the future, respects their choices, meets their diverse needs, and earns their trust and confidence. So thank you. I'll now pass it along to Dr. McMullen to say a few words.
Thank you, Minister. My name is Dr. Lynn McMullen. As a professor emerita, which means I'm now retired, of food microbiology at the University of Alberta, and a food safety expert, I want to focus on a critical issue that impacts the health and safety of our children: food safety in childcare settings. Many may remember the devastating outbreak of E. coli 157H7 in September 2023 that impacted hundreds of children and their families. I think we would all like to see steps taken to ensure that this can never happen again. In response to the outbreak, Alberta's government commissioned the Food Safety and Licensed Facility-Based Childcare Review Panel, which examined food safety in licensed childcare facilities across Alberta, and we made recommendations on how to better protect our children. I was a member of this panel, and as a team, we were really proud to present the government with several key recommendations to improve food safety moving forward. I'm really glad to see the government stepping up to take the recommendations and solidify them into legislation. As the minister outlined, the government's Early Learning and Childcare Amendment Act will address one of our key recommendations. The panel reviewed the Public Health Act, the Food Regulation, the Institutions Regulation, the Early Learning and Childcare Act, and Early Learning and Childcare Regulation, and any applicable standards and guidelines and operating procedures that apply to food safety and licensed childcare facilities. There was a lot of legislative review to do. We found that Alberta's legislation needed to be strengthened and streamlined to ensure that every child care operator understands the regulations that apply to them. At the time, this was not clear. As an expert in food safety, I can't stress enough how important it is to implement this recommendation from the panel. The recommendation is clear. All facility-based license holders must comply with applicable zoning, health, and safety legislation. This is crucial. By implicitly stating which health and municipal legislation applies to their operations, namely the Public Health Act and the Safety Codes Act, we can create a stronger framework for accountability and enforce a strong safety of culture and food safety, especially in our childcare settings. Parents really need to be able to trust that their children are safe, and these measures will help to reinforce that trust and will ensure that a situation like the E. coli outbreak never happens again. I wholeheartedly support this legislation for the well-being of our children and the peace of mind of their families. With that, I will turn it over to Bernice Taylor, a trusted childcare operator in her community. Thank you.
Thank you, Dr. McMullen. Good afternoon, everyone. My name is Bernice Taylor, and for the last 30 years, I've worked as a child care director here in Alberta. I currently manage the town of Drayton Valley's Early Childhood Development Centre, which has proudly served our community for 17 years. I'm excited to speak with you today about some important changes to the Early Learning and Child Care Act, one of the acts that govern how child care providers operate in Alberta. It's my opinion that these changes will make a positive impact for our families and children across the province. I want to be clear, I'm not a perfect, our centre is not perfect, no child care operation is perfect, but the perfection is not what the legislation is looking for. This legislation is meant to target our system's bad actors, the ones with chronic non-compliance issues, the ones who give child care providers a bad name and break down the trust in child care system as a whole. This legislation is looking to put our children's safety first and give child care providers the clarity they need to deliver the best possible care to their communities. After reviewing the proposed changes, I too feel I have a better understanding of what is expected of me by the province and as a child care provider. Clarity is important, so we can operate our child care centres and family day homes knowing we are following the rules that are expected of us. This legislation is also important because not only do we want children to be safe and give providers a clear understanding of expectations, we also want our parents to have peace of mind. Parents want to know their children are safe in our care, while they are away at work or school or trying to provide for their families. These changes let parents take a sigh of relief. By improving oversight and introducing real consequences for operators who don't meet safety standards, the government is sending a clear message: we won't tolerate unsafe care. As a child care provider, I stand by this. Top quality care is what we should all strive for every day. Again, there's no doubt most child care providers in Alberta are doing an amazing job serving their communities. These amendments will only hold chronically non-compliant operators accountable, and I'm grateful for that. As a child care provider, I've looked after children my entire life and my entire professional life. I deeply care about child welfare, and I want our system's rules to put our children first. In short, I support these changes to the Early Learning and Child Care Act. Together, we can build a stronger, safer child care system for our children and families. And with that, I'll pass the mic over to another child care provider and mother, Austin Goldie, and her 2 children who are going to come sit with her. Thank you.
Thank you, Bernice. Hi, everyone. As Bernice said, my name is Austin Goldie. I've been a childcare educator now for the past 14 years and the director of Narnie Learning Centre in Lethbridge, Alberta. But most importantly, I'm a mother. I have to say I don't usually do this sort of thing, so bear with me, but standing up here today is a little out of my comfort zone, but I'm here to speak because I know it's important. The changes talked about today with the Early Learning and Child Care Act will help me as a parent and an advocate for children in our province. My children know how it feels to be able to attend a safe, high-quality childcare, and the painful reality is that some do not. I have 2 children, Paige and Evan, here with us today to see government in action and to see their moms stand up for them and kids like them across our province. Parents place a lot of trust in their childcare provider. You leave your children with someone all day, and you entrust them with their well-being, with their health, and with their safety. Giving a stranger that level of trust, it can be a scary thing for a lot of parents, but that's why this proposed change is so important. These amendments will strengthen oversight and make our childcare system safer, more transparent, and more accountable, because our kids deserve nothing less. I stand here today as an owner and director of a childcare program and know firsthand that programs like mine are fully able to maintain that level of health and safety for our children, and it is our duty. I feel the need to speak up today to encourage childcare programs across our province to meet higher standards as it is possible and necessary for the children, the staff, and the families in our community. As a parent, this means that when you drop your child off in the morning, you can do so with confidence, knowing that they're being cared for by qualified professionals who prioritize their safety first. With these changes, you'll have clear insight into the qualifications of staff caring for our children and any past order to remedy issues. Having access to this information is so key for us parents, because I don't know about you, but as a mother, I would like to know if my childcare center is failing to keep my children safe or to not be able to meet those vital health and wellness standards. And I would bet a lot of parents feel the same as me. Simply, this level of transparency empowers parents to make informed choices that are best for their family. We all want a childcare system that we can trust, one that supports the children's growth and development and gives us confidence every day when we drop our little ones off. So thank you very much for your time today, and I appreciate being part of this process.
Thank you very much. That brings us to the end of the formal portion of our news conference. Now we'll move to the media question and answer portion. As a reminder to all the reporters present on the phone and in person, we have the following people available for answers. So we have Minister Guthrie, who is available to answer all questions. We have Dr. Lynn McMullen, who will answer questions on the food safety panel. And then we have our other two validators who are available for comment after the press conference by emailing me. We have time for one question and one follow-up. To the media, we just ask that you identify yourself and your outlet and let us know whom you're directing the question to. So with that, we'll go to the questions in the room. Please go ahead.
Yeah, Manuel Prince-Tovet with Radio Canada. Dr. McMullen, I have a question for you. You were on the panel on the E. coli outbreak in, you can come to the podium. So you were on the panel about the E. coli outbreak in Calgary. In your opinion, what was the most important recommendation of this report?
I think the most important recommendation in terms of the Early Child Care and Learning Act and regulation is getting the legislation clear. One of the problems when we reviewed all the legislation, there was language differences between and terminology. There were some differences in terminology related to food safety among the different pieces of legislation. So it wasn't clear on what the expectations were for operators. So one of the recommendations was that gets cleaned up. And so it's clear to operators what they are responsible for and what they need to do to protect our children.
So from what I understand, this act only applies to one of your recommendations in the report. There are a bunch of other ones, like create a kind of tag team of inspectors to go in childcare facilities. Do you think that these should be enacted, and if so, when?
As far as I'm concerned, as a panel member, I think all of the recommendations should be considered for implementation. Some of them can be implemented fairly quickly because they don't require legislative changes. This is the first legislative change we've seen. There are others that require legislative changes. They will take some time because they have to do some consultation. There's one that it will impact a broader base, I suspect, on having a culture of food safety in the operations. This will take some consultation in developing how we can help operators do that to ensure that food is safe for children that they're serving it to. So that's going to take some time. I understand that. If it was me, I'd like to see it there now, but I know that's not realistic.
Thank you.
All right, thank you. Next question.
Yeah, Catherine Gurkowski, Alberta. I'll get you to stay there. Sorry, I don't want you to have to go up. So it's not necessarily intuitive to a lot of people, probably. How does a lack of clarity in food safety terminology lead to an E. coli outbreak? Like, can you connect the dots there, and why is it an important recommendation?
Some of the language in the legislation was very different. And if you specifically, if you look at the codes that go with the regulations and the legislation, there was some differences in what people call things. And the word shall was used a lot. So for example, it was not required that operators take the temperature of the food and write it down. So if they're cooking something, they were not required to write that temperature down. So there's no accountability. That is one of the recommendations in there. And that's part of the food safety culture, is that you take responsibility for what you're doing.
And my follow-up question, sorry, would be to the minister. You talked about the importance of acting swiftly, but most of these changes are expected to take effect next spring. The administrative penalties aren't coming until the fall. Why was it timed that way?
Yeah, there's some IT work that's going to be necessary. So for proclamation to take place, we wanted to have that built out. And so that's going to take place in the spring. The administrative penalties, that still has to go through development. We also, after putting it together with the statutory director, as well as the rest of the team, we want to be able to discuss that with the industry and give them some lead time. So the administrative penalties won't come into place until the fall of next year. And just one note, as far as on the health and safety panel, there is still more work to be done, as was mentioned. Some of it falls within the Department of Health, as you would well imagine, and there are current legislative and regulatory changes that are underway and under development.
Thank you. Yes.
Cindy Tran with the Edmonton Journal. This is for the minister. So since administrative penalties wouldn't come into effect until if this legislation passed, what were the consequences currently in place then if a child care provider didn't meet, like say they were jeopardizing a child's safety, but their thing or what they did didn't necessarily warrant like a license suspension, but would have resulted in a monetary penalty? I guess what were the consequences there?
Yeah, there was shutdown or suspension, as was mentioned, but there was no administrative penalty that could be incurred. So naturally, that is something that we wanted to implement and was recommended. This legislation places a $10,000 maximum for each infraction. So it can be substantial, but that still has to be built out.
And my second question is, how many child care facilities were shut down in the past year?
Well, so there's probably right now 2,700 operators. In the last 3 years, I could tell you since ELCC came into effect in 2021, there was 14 that had been shut down. I'm not sure over the last year. I think the department could get you that. So if you work that out, I think we're talking about 0.6%, less than 0.6% over the course of 3 years. So you're looking at 0.2-ish% that were shut down over that time frame. So we're talking about a very small amount of bad actors and really ultimately a very good sector.
Excellent. Thank you. And at the back?
Travis McEwen, CBC News Edmonton. I'm wondering what it is that the province is seeing to warrant giving more authority to the folks who oversee childcare in the province.
Pardon me?
What is the province seeing to warrant giving more authority to the folks who oversee childcare in the province?
Well, I guess when you bring about legislation, sometimes there's still more work to be done. And you get it out there. We worked with it for the last few years. Take feedback from the industry. And this is one of the major things that came back from industry, is they want to see the good actors, people that get into this business, they want to help children. They want to support children. And they don't want to see bad actors. And if there are bad actors, they would like to see them removed from the system. And so really, ultimately, it's feedback from industry that caused us to make these changes and give that authority.
We've seen a lot of closures happening recently in the province. How do these changes relate to that, and could we expect to see more under these changes?
The specifics of those that have been shut down, I guess I'd have to leave to the department. This isn't my file, but I can certainly provide you with some feedback there, or the team can. Yeah.
Thank you for that. And with that, operator, can you please put through our first caller?
The first question is from Matthew Black from Edmonton Journal. Your line is now open.
Oh, good afternoon. Just on the topic of closing down daycares again, the department had to shut down a couple in Edmonton recently, and that's unfortunate, of course, but some parents have gotten in touch to say when that happens, they're essentially given a list of daycares, some of which aren't necessarily even in the city, and well wishes on finding a new facility. They're also out in some cases more than $1,000 having prepaid for the month's care ahead of time, and it's not always easy or sometimes even possible to get that money back. What would you say to the parents in those situations, and what more could the department do to consider doing to support them?
Well, once again, this is not my file. Unfortunately, I cannot provide you with all the insight and detail there, but I will promise you that we can have somebody from the department follow up directly with you on that and provide you with the detail you're looking for.
Okay, thanks very much for that. I'm also hoping you can confirm if you attended any Edmonton Oilers playoff games this past spring and summer, and if so, how many and whose tickets they were.
Okay. Well, look, moving to Edmonton, when I was a teen in the early 80s, it certainly made it pretty easy for me to become an Oiler fan. I can say that after a couple of rough decades, I was really pleased to see the team have a lot of success, making it to Game 7 in the Stanley Cup Finals last year. And having an opportunity to see some games over that stretch was amazing. And I hope that they can have continued success and bring home the cup this season. I see Connor McDavid got injured. He's out for the next 2 or 3 weeks, so that's unfortunate, but it's a bit of a rough start for them, but I think they can pull it together. Now, that said, all disclosure requirements were fulfilled with the ethics commissioner, and it will be part of my year-end member filing. And I can say that I had no personal or business relations with the host, MH Care, or any of their affiliated companies. And I guess the final thing I might remark is that, Edmonton was the only destination in which I attended games.
Thank you, Minister. Next call, please.
The next one is from Lawrence Toshera from Radio Canada. Your line is now open.
Hi. So my first question would be, how is the child care lookup tool that already exists any different from what the parents will receive with this new legislation change for information? Is it just going to be a different tool, different information? Because there's already that tool that exists that you can just check the past history of the child care.
Yeah, there'll be increased exposure there. As mentioned, we're going to be building out a new IT platform. This also will incorporate day homes and unlicensed facilities. They will also be required to post. So that'll be found on that site as well.
Okay, so it's a different platform, but with similar information.
Increased information, increased exposure, yeah.
Increased information.
Yeah.
And my second question would be for Dr. McCullen. So you mentioned that not all recommendation needs legislation change. So how many recommendations have already been in place that do not need a legislation change? And are you satisfied with that time frame?
In asking the question of Alberta Health and my contact there, they are in the process of doing some of the changes. It's not a simple process. As I said earlier, there has to be some consultation because there are some broader impacts to some of these changes on operators beyond daycares. So they want to do some consultation and make sure that the industry understands why they are doing what they are doing.
Okay, just to confirm, so this would be the first recommendation that would be put in place.
That is correct. This one is the first recommendation that will be changed in law.
Okay.
Thank you.
All right, to the next caller on the line, please.
The next one is from Alicia Fieldberg from CTV. Your line is now open.
Thank you. Hello, Minister. This question is for you. A bit of a clarification, please. It seems that aside from the unlicensed providers having to provide information about any stop orders, that these changes are really aimed at licensed childcare. Now, is that accurate? And if so, why are unlicensed operations not targeted?
Yeah, it might seem that way, and I think for the most part that's true. However, we will not only be having stop orders displayed for unlicensed, but they will also come under the penalty, implementation. So there will be, and they will fall under those same administrative penalties.
Okay, they will also fall under the penalties, but what about all the other rules? And will there be the same kind of rules for a licensed provider, with regarding food and safety and that sort of thing? Are they now under all of those rules too, or just the penalties and the posting of the stop orders?
Well, providing high quality care for children is naturally paramount. The unlicensed facilities generally have up to 6 children under care. We can do inspections there. That said, as far as the detail of unlicensed facilities, I think I would just have to recommend you to follow up with the department. They can give you all that detail.
All right, thank you, everyone. That concludes the time we have available today for the press conference. If you have additional questions or follow-ups, please don't hesitate to reach out to me. My contact information is found at the bottom of the news release. Thank you so much, and have a great day.